Okay, good evening, guys. This is discussion for you all. We're discussing psoriatic arthritis and osteoarthritis. Now, they're both are forms of arthritis, but they have very different causes. So I'm gonna go through those for you this evening for B. So please join me in tonight's presentation B. Here we go. Psoriatic arthritis and osteoarthritis are both types of arthritis, but they have distinct causes, symptoms, and risk factors, and treatment. Causes: osteoarthritis occurs due to the gradual wearing away of cartilage in the joints, often linked to aging. Psoriatic arthritis, on the other hand, is an autoimmune condition where, where the immune system mistakenly attacks healthy cells. Symptoms: osteoarthritis typically causes joint stiffness, swelling, pain, and movement difficulties, primarily affecting the hands, hips, knees, and spine. Psoriatic arthritis can lead to thick or scaly skin, patches, nail dents, or crumbling, and joint stiffness, which tends to worsen in the morning. Okay, guys, give me a minute. Change the paper. Risk factors. Osteoarthritis is more common in individuals over 40, those with obesity, or those with joint injuries or jobs that stress the joints. Psoriatic arthritis is often linked to family history and can also be triggered by infections, typically affecting people between 30 and 50 years old. Diagnosis: both conditions may require imaging tests like x-rays, MRIs, CT scans, or ultrasounds to assess joint damage. Osteoarthritis is diagnosed based on joint pain and swelling, while psoriatic arthritis is identified through joint sensitivity, skin and nail changes, and bony growths around the joints. Treatment: both conditions can be managed with lifestyle changes, physical therapy, and NSAIDs. Osteoarthritis treatment may include joint replacement surgery, while psoriatic arthritis may require steroid injections and biologic drugs. Psoriatic arthritis can cause a range of symptoms that affect the joints, skin, and nails. Here are some of the most common ones. Joint pain and stiffness. This occurs in any joint, often worsening in the morning or after periods of inactivity. Swelling and redness. Affected joints may appear inflamed, and fingers and toes can swell into a sausage-like shape, a condition called diacystitis. Foot pain. Pain can develop where tendons and ligaments are attached to bones, especially in the heel, which are arches, tendons, or soles of the foot, plantar fasciitis. Okay, give me a second, guys. I have to get paper. Does it change? Now, lower back pain. Some people experience inflammation in the joints between the vertebrae of the spine, leading to stiffness and discomfort. Nail changes. Nails may develop pits, crumble, or separate from the nail bed. Eye inflammation. Psoriatic arthritis can cause uveitis, leading to eye pain, redness, and blurry vision. Symptoms of psoriatic arthritis can vary widely among individuals due to factors like genetics, disease progression, and overall health. Here are some ways symptoms can differ. Severity. Some people experience mild joint pain and stiffness, while others develop severe inflammation leading to joint disformities. Okay, give me a minute. Gotta get this separated. Okay, affected areas. While psoriatic arthritis commonly affects the fingers and toes and spine, some individuals may have symptoms concentrated in specific joints or tendons. Skin and nail involvement. Some people have extensive psoriatic arthritis with thick scaly patches, while others may only have mild skin changes or nail pitting. Flare-ups and remission. Symptoms can come and go, with periods of intense pain followed by times of relief. Additional complications. Some individuals develop eye inflammation, that's uveitis, fatigue, or even gastro gastro in, gastrointestinal issues linked to autoimmune activity. Okay, here's the question for this section of piece. Would you like to explore how different treatment approaches can help manage these variations? Okay, let me get these sheets right here. Several factors can influence the variation in psoriatic arthritis symptoms among individuals. Genetics, family history plays a role in disease severity and progression. Immune system activity, fluctuations in immune response can trigger flare-ups or remission. Environmental factors, weather changes such as humidity and temperature shifts may have a small impact on symptoms. Age and disease duration, older individuals or those with long-term psoriatic arthritis may experience more persistent symptoms. Lifestyle choices, diet, exercise, and stress management can affect symptom severity. Okay. Hold on. Comorbidity conditions. Other health issues such as diabetes or cardiovascular disease can influence symptom variations. Managing psoriatic arthritis effectively involves addressing the factors that influence symptom variation. Here are some strategies. Medication adherence, following prescribed treatment such as NSAIDs or DMARDs or biologics can help control inflammation and prevent joint damage. Lifestyle adjustments, regular exercise, maintaining a healthy weight, and avoiding smoking can reduce symptom severity. Stress management. Since stress can trigger flare-ups, relaxation techniques like meditation, yoga, or deep breathing exercises may help. Last page, guys. Okay, dietary changes. Anti-inflammatory diets rich in omega-3 fatty acids, fruits, and vegetables can support joint health. Environmental awareness, protecting joints from extreme weather conditions, and using ergonomic tools can minimize discomfort. Okay. Early intervention, seeking medical advice at the first signs of worsening symptoms can prevent long-term complications. Would you like recommendations for specific exercises or dietary plans tailored to psoriatic arthritis? Okay, guys. So that is B for you all. I will be back on with C shortly in a bit. I'm going to take a small break and I'll be back on with C. See you guys for C in a bit. For now, Gator Wellness. Take care, folks.